Dr. Todd Perry here. So I thought today we'd make this video about shoulder problems. We're going to talk about the anatomy, we're going to talk about posture, we're going to talk about some stretching, and then we'll go through some exercises that I think will be good. The shoulder is something I see a lot in my office, shoulder complaints. People come in, and as we get older, after about age 40, just like the discs in our back, just like so many other things, the rotator cuff starts to lose a little bit of its pliability, the blood flow isn't quite as good, we start to have problems. So we want to optimize what we can with that rotator cuff. Now, oftentimes with our shoulder, a lot of things are kind of fighting against us. If we are not doing things to correct that, then we end up with more problems. And what's fighting against us? Well, most of the things we do, even the weightlifters, everything's kind of in front. We're doing a lot of pushing. We're kind of hunched over at our desk. Everything's kind of in here, okay? And that tends to bring that shoulder blade around, tends to bring things forward for us, and that makes it tougher for the shoulder joint to work as it should. Okay, so we want to be bringing things back, opening that up, letting the shoulder have room to move. So today we brought in the skeleton so we can look at that as kind of an example. Let's look at the anatomy of the shoulder. So you've got your shoulder blade back here, that triangle, and then connected to that is the humerus, or that ball of the shoulder. The rotator cuff are muscles that come off of this shoulder blade, several in the back and several through the front, and they engulf or encircle that humeral head. Their job is to keep that humeral head, that ball, nicely in that socket, while your big muscles, your pectoralis, your deltoid, your latissimus, those big muscles, as they move that shoulder around, the rotator cuff has to keep it right there. Now, we're at a disadvantage, I already talked about that, because we've got 4 muscles that pull things around to the front. We only have 2 that open it up and rotate it back with that rotator cuff. So we need to consciously be doing exercises to keep that toned, especially with our sedentary lifestyles, to optimize the function and prevent problems in our shoulder. Okay? So again, 4 muscles are pulling us kind of around and down. Only 2 of those rotator cuff muscles are pulling us back. And as we become kind of around and down, it is tougher to lift your arm up. Okay? If you kind of are hunched over, it's tougher to lift that arm. Now, if we pull those shoulder blades back, we use our muscles that connect that shoulder blade to the spine, okay? And we pull that shoulder blade back and up. That opens up right here for us and gives the ball more room to rotate before it impinges. So on me, what's that going to be? So if I'm forward and I'm trying to lift that shoulder, it only wants to go so high. Now, if I consciously, beforehand, pull those shoulder blades back and up, boy, it's just a lot easier now to bring my arm up overhead. Okay? So that's what we want to focus on a lot in prevention of shoulder problems, is giving that rotator cuff the optimal place to move under that shoulder. Okay? So let's start with that. We talked about the anatomy, what we want to do. Now let's talk about simple things. 1, stretching. Okay? So stretching is huge to keep that loose. Everything's keeping us down. We want to focus on our stretching, on really making sure we're coming up and back. So the first stretch I like is just bring those arms up overhead. Now when I say bring them up overhead and stretch, I can just kind of do this and say, yeah, my arms are up here, yeah, I'm stretching. But there's a huge difference if all of a sudden I say, I'm going to reach for that ceiling. My whole voice changes as you really exert. And you're not doing anything, but reach as high as you can, and you start to fire or engage a lot more muscles. So that's what you want to do. Now the other thing, so spend some time just stretching and getting up as high as you can. The other thing you want to do is with your shoulder blades. We just talked about, we want to bring those up, back, and down, okay? So when you're standing in the grocery store line and you got nothing to do, stand there, pull your shoulder blades up, back, and then down, and just hold it for about 10 seconds till they start to cramp a little bit on you, till your face is funny and the people next to you are wondering what you're doing, and then relax. And do that again. Up, back, and then down, and just squeeze those shoulder blades as close together in your back. Great exercise to just kind of do that simply on your own and tone those muscles to get your shoulder blade used to moving. So a lot of people I see, and even I've got a little bit of laxity in my left shoulder, and I'll do things and it bugs me. But if I focus, okay, shoulder blade back and down, and then I do it, a lot of that pain that ache that I was starting to feel come on disappears. So stretch that, work those muscles of the stabilizers of the scapula to get that in appropriate position. Other stretches. I love just taking your arm and just making a circle, okay? And I'll do it fast and try and get a little momentum behind it. So it's really, when it's over here, I know it's really pulling those back muscles. When I know it's here, it's really pulling those top ones. As I come back here, it's stretching that pec. So just kind of roll that thing, give it a little bit of momentum and get it going. Do both your arms that way. Then take advantage of your wall, okay? I like to come in and first put my elbow on there and then start leaning my body into that wall. Get that arm, get that elbow up above that ear and crunch it back. So really work on bringing that back this way. Then I'll work on kind of stretching that chest out. So I'll bring that in here and I'll put my hand flat. You can use any wall and start to rotate away. And I do that, I feel everything really stretching through here. Your pec, your anterior deltoid, everything along that muscle is going to stretch. All right, so we had some camera problems there on that one. A couple days later, find out it didn't film what we thought it filmed. So let's keep going. We're going to finish that kind of pec stretch, that anterior shoulder right through here. Okay, we've already stretched overhead. Then we're going to come in and we're going to work on the back capsule of the shoulder, something that often gets tight and causes some problems. Just grab that arm, bring it across the chest, and pull, pull, pull right in there. Okay, so I'm pulling with this arm, bringing that elbow in, feeling that stretch across the back. Another thing we want to do, whether I'm laying on a bed or up against a wall, I'll bring that arm straight out in front of me, bring it to 90 degrees, and then start pushing down right here. Okay, that's going to work on our internal rotation, our ability to reach behind our back. Okay, so I've always been tight there. That's just the way I'm built. You can also grab a towel, hold on it with both hands, and use that to kind of pull that direction as well. But I like to, it's so convenient, just come in here and push. Okay, so those are the stretches we want to do for our shoulder. Okay, we get that limbered up. Now let's talk about some strengthening. Okay, so we go back to our reliable friends, the TheraBands. Okay, they come in multiple different strengths. Yellow's the easiest, then we've got red, then we've got green, it goes on to black. Okay, so buy a set that has several of them. I tie a little loop in it just like this. I have the same thing on the other side. I put that through the door, close the door, it locks it down. Or you can tie it to a doorknob. Okay, rotator cuff strengthening. We said we want to really work on the ones that open it up. I think the most important, lock your elbow at your side. So your humerus, your upper arm's not really moving, just rotation right here, okay? Do a lot of this, and it's an endurance muscle. So you're really not just doing 10 repetitions, you're gonna keep going till the muscle just fatigues. You can change it a little bit. If I face it, I'm working more on the last part of that arc of motion. If I lean away from it, now I'm gonna be pulling more at the beginning part of that arc of motion. Okay, and we're just gonna do that, turn on the TV, you're going to do that till you get tired. Then you're going to do the other shoulder. Okay, so that completes our external rotation. Now we're going to do internal rotation. I'll just switch arms, or I could switch sides if I was going to do this side. So working internal rotation, elbow at your side. I'm going to step away a little bit to make that a little bit tighter. I'm going to pull in. I'm going to rotate right across here. Okay, upper arm doesn't move, elbow stays at your side. If I want to work the beginning of that arc of motion, I turn away a little bit more. Okay, if I want to work the end of that arc of motion, I turn and face it a little bit more. Again, you're going to muscle fatigue, so you're going to do a lot of these. You know, we're talking over 50 until you really feel it. When you watch the bullpens at professional baseball games, you'll see the guys who aren't pitching that day, they always have these rubber bands. This is what they're doing, okay? They're working that rotator cuff, so they stabilize that ball in the humerus and prevent problems even when they're throwing the 90-mile-an-hour fastball. Okay, so really important if you have any kind of shoulder issues, you got to focus on that rotator cuff. Now we can also augment that a little bit. We can come in here and we can go forward. If I'm facing away from the wall or towards the wall, elbow is now kept straight, and I'm working a little bit that anterior deltoid right here. Okay, so we're going to augment a little bit of that rotator cuff with some deltoid work. We're now going to switch. Again, let me show it right here. So elbow straight now, and I'm coming forward. Okay, I'm working that anterior deltoid. Now we can also do the back. I'm now facing the wall. I keep my elbow straight. I'm now going back. Okay, now if I do it this way, I'm working triceps, if I come in here, I'm working kind of the back there. Bringing it forward, working the back of that deltoid. Okay, so that's the things that I like to do with the TheraBand. Now you can get fancy and you can start doing some across the body kind of motions, which are all great, but make sure you at least start with those activities that we did for the rotator cuff. All right, so now we've got some suspension bands. You can throw them over a bar down at the playground. Just get 2 ropes, some little handles you make. They sell some cheaper versions, but I really love them because you use body weight again. Now, what we're going to do here is that external rotation and focus on the shoulder. So I'm leaning back. I have my elbows again locked at my side, and I'm going to rotate out. Okay, and you can do it with your elbows locked at your side. And then I like to mix it up. And is what I do now is I bring my arms out here straight, leaning back, so I'm kind of making this angle. Now I'm going to keep my elbows straight, and I'm going to do kind of a T motion. Then I'm going to bring them back. Now I'm going to make a W motion with my elbows. Okay, so I got a T, then a W. Now I'm going to do a touchdown, okay, or a Y. So I come in here. That really works the muscles of the upper back right there. Okay, so again, T motion right there, and then I come up to a W, trying to keep my weight back on my shoulders, keep my core strong, and then come up big. And right here, you really want to pull those muscles again like we talked, scrunch those shoulder blades back together. That's the objective right there. T, I'm scrunching my shoulder blades. W, I'm scrunching those shoulder blades together. Touchdown, I'm really scrunching those shoulder blades together. So that's what I like to do with the suspension band because it really works that upper back and rotator cuff. So now we picked up some dumbbells. Stay light, okay? Especially if you're getting older like me, you're not winning any races. You're not. Just don't hurt yourself, okay? I like dumbbells as opposed to having a bar. Take them right here. I like to start with them here in this direction and turn as I go up. So I've got them facing here. I rotate my wrist as I go up, okay? So you've got your simple shoulder press right there, okay? And then we can work on our deltoid lateral raises. We're going to come up and out. When we do that, just like we talked earlier, shoulder blade placement, up and back. And when I come up, I'm kind of raising my thumbs up, okay? If I internally rotate like that and I keep my hands even, a lot tougher on the rotator cuff, okay? We want to make it easy, okay? So again, up and out, thumbs are going up. Up and out, thumbs are going up, okay? And you can alter that. You can bring them in, do a couple of those, and then come up, go overhead. Okay, so don't neglect those shoulders. We talked about some stretches. We talked about the anatomy. Get things in proper form and function. Stretch it. Do these basic, simple exercises. Try and keep the shoulder toned and prevent problems.